Is Plaquenil effective for all lupus flares? When it comes to managing lupus, many people wonder if Plaquenil is a reliable treatment for every flare. The truth is, Plaquenil, which is the brand name for hydroxychloroquine, is a common medication used to help control lupus symptoms. It is often prescribed because it can reduce inflammation, decrease disease activity, and help prevent flares from becoming more severe. However, it is not a cure and does not work equally well for everyone or for all types of lupus flares. Plaquenil is particularly effective in managing skin rashes, joint pain, and fatigue associated with lupus. It has been shown through numerous studies to improve long-term outcomes and reduce the frequency of flares in many patients. It works by modulating the immune system, calming the overactive immune response that causes inflammation. Because of its safety profile and benefits, it is usually recommended as part of the standard treatment plan for systemic lupus erythematosus. However, the effectiveness of Plaquenil can vary depending on the individual and the specific nature of their lupus flare. Some flares involve organ systems like the kidneys or the central nervous system, where additional or different medications may be necessary. For example, if a lupus flare involves kidney inflammation, doctors might add immunosuppressants or corticosteroids to better control the disease. In cases where skin or joint symptoms are predominant, Plaquenil might be sufficient or highly effective. It is also important to note that Plaquenil typically takes several weeks to months to reach its full effect. Patients often start to notice improvements in symptoms after about 4 to 6 weeks, but it can take longer. During this time, doctors will monitor the patient closely, adjusting treatment if needed. Some patients may not respond well to Plaquenil alone and may requiring additional therapies to control their flares effectively. Furthermore, not all lupus flares respond to Plaquenil because the disease is highly variable. Some flares are driven by different immune pathways that Plaquenil does not influence as strongly. In such cases, other medications like corticosteroids, immunosuppressants, or biologic agents might be necessary. It is also worth mentioning that Plaquenil is generally well tolerated, but it can cause side effects, including problems, which requiring regular eye exams to monitor. In summary, Plaquenil is a valuable medication for many lupus patients and can be effective in reducing certain symptoms and preventing some flares. However, it is not a universal solution for all types of lupus flares. The effectiveness depends on the individual, the specific symptoms involved, and the severity of the disease. It is always essential for patients to work closely with their healthcare team to develop a personalized treatment plan. If a person's symptoms do not improve with Plaquenil, or if their flares involve critical organs, additional or alternative treatments may be needed. Consulting with a healthcare professional is the best way to determine the most appropriate approach for managing lupus flares safely and effectively.